Hello, this is Dr. Douglas Beck. I am an audiologist with the Hearing Matters podcast, and today it is a distinct honor and pleasure to introduce my mentor, Dr. Jack Katz. Jack, thanks for being here.
Thank you so much. I really appreciate this opportunity.
Well, I appreciate everything that you did for me. You were my chairman when I was an undergraduate, and somehow you let me into my graduate program. And gosh, that was just over 40 years ago.
Oh,
Yeah, I know.
uh,
And since then, audiology has changed quite a bit, as have I. When I go back to look at your intro, here's what I came up with. Since 1962, Jack Katz has given hundreds of talks, lectures, demonstrations, and workshops in the U.S., Canada, Central and South America, Europe, Asia, and the Middle East. Most of his workshops deal with central auditory processing, or the SSW. And let me amend what I just said. These are not things I came up with. These are things that I found on your website. So,
oh,
in 1956, you got your bachelor's from Brooklyn College. In 1957, you got your Master's of Science in Audiology and Speech Path from Syracuse University. 1961, University of Pittsburgh, that was your PhD. 1956 through 57, you were a speech therapist in the Department of Health at Syracuse. 1957 to 58, speech and hearing therapist for the Board of Cooperative Educational Services in Cayuga County, New York, which is in the Finger Lakes. 61 to 62, assistant professor at DeKalb, Northern Illinois University. 62 through 65, assistant professor, Tulane University School of Medicine in New Orleans. 1965, 1970 to 1974, 9 years, director of Hearing Speech Education Department at Menorah Medical Center in Kansas City, Missouri. In 72 to 73, senior Fulbright lecturer Ankara in Turkey. And I want to say, Dr. Katz, I don't know if you remember this, but about 45 years ago, you were giving us a lecture on how people remember language and thoughts and things. And you were teaching us that if you're going to learn a foreign language, you should never do things like teaching fork, knife, and spoon all at the same time. You just teach one or the other, and usually fork is a good one to go with. And then you gave us this word in Turkish, which I remember to this day, which was karit, which I think just means paper. Anyway, and then 1974 to 2002, professor of communicative disorders and sciences at the State University of New York at Buffalo. 2002 to 2003, distinguished visiting professor, hearing and speech department, University of Kansas Medical Center. 2003, research professor, University of Kansas Medical Center. And 2004 forward, last 20 years, auditory processing service in Prairie Village, Kansas. Did I get that right?
yes, but we have to update it a little bit.
Please.
The people that I was renting in my private practice sold the building.
Okay.
And so I had 1 month to leave. And so I was working with Julie Teefy, who was an audiologist, on a revision of one of the books.
Right.
And as we were talking, I said, oh, by the way, I have 30 days to figure out what the heck I'm going to do with my life.
Oh, my goodness.
I said, well, I have to leave here. And so I said, I'm 87, and I don't know exactly how I'm going to do it. She said, wait a minute. And she typed into her phone something, and then she said, we went on. And 10 minutes later, she looked at her phone and she said, you now have an office. So she contacted, obviously, her boss and found out if they could provide an office for me. So actually, I didn't ask for it, but they let me use the name for my clinical practice. And so I still have that inside of their program, and they are inside another medical program.
That's fantastic. It's still in Prairie Village.
It's in Merriam, Kansas.
Merriam, Kansas. Good to know.
Yeah.
I'd like to have you just tell us about yourself, because I think you're a legend. You're one of the few legends in audiology. I was so honored when I was admitted to that program, and your stature in the community, at the university, and the profession, unmatched. And I was just so delighted to be there, and I still am. But tell me about your education,
Thank you so
because
much.
your early education was not typical. You were a struggling student, as best I recall.
Yes, yes. Now, to understand all of my problems, we have to go back to when I was 3 years old. Over the years, I've thought back about those years, and then I start to understand what my issues were. When I was 3, I had a tonsillectomy and adenoidectomy. In those days, they had no clue what otitis media in young children does to them. And so for them to have me get that surgery, that's all they didn't have tubes.
Right.
Have that surgery in those days, it had to be horrendous. Even now, I'm trying to get some of these high school students who need the help, and the doctors put it off. No, no. Believe it or not, it's the first thing in my memory. I don't remember anything before going to the hospital for that surgery.
Yes.
I remember a little bit when my mother checked in, and I remember where I was lying down in this room. And then when they did the surgery, I still remember the doctor telling me to count to 5, as if I could count to 5. And then he put the mask on, and I don't remember the rest.
Right. That was the benefit of ether anesthesia.
So our family was poor, but my parents had to give me ice cream. That was what for the first few days.
Sure.
So that was a benefit.
You had otitis secondary to all of these infections, because when you have a tonsillectomy and adenoidectomy, which is lovingly called a TNA, when you have that done, most often, I have to think 97% of the time, that child or that adult is also going to have a lot of eustachian tube problems, giving you otitis secondary to that. And so you had that removed when you were 3. And the shocking thing to me is that you can remember that. That's extraordinary. My youngest memory, I think I was 57. I don't remember. But this is really stretching my memory a little bit. But when we were undergraduates, so we're talking about, gosh, I think it was 78, 79, something like that, 45 years ago. I remember you shared a theory with us that you said was a theory, but I think it's proven itself in the last couple of decades, that children with untreated otitis media, because they are getting a fluctuating signal, some days they hear louder, some days quieter, some days more clearly, some days more distorted. So their brain doesn't have that constant repetition of speech and language. And your theory back then, this is 45 years ago, but you had said that might have a lot to do with auditory processing disorders as the child grows up.
Now, I would agree, but now I would think that the most important thing is deprivation.
Yeah.
You deprive the ear of sound, then that's going to affect the auditory system. And in our study, what we did, we found this correlation between otitis media or middle ear problems and tone decay. That people, right after having these problems, they showed tone decay. In fact, they showed it later on too. It means, and there's some studies that came before that said that it had to do with the auditory system not supplying the synapse with the necessary information, fluid, or to make an accurate production. So it interfered with how the system was operating. So,
which overall makes very good sense, right? Because as you're stimulating the cochlea and the auditory nerve through the synapse between the inner ear and the eighth nerve, what happens is your brain has been trained to seek information and in this case to let information go, because that's what it's been trained to do. So it doesn't maintain the same signal strength over time as you would expect. I think. I mean, I can't
Yes.
prove that, but
Well, we did that with an animal once, and for 20 or so hours, the animal was in a soundproof room, and we surely found that affected at least threshold. And I'm quite sure that I'm so sorry that we've given up on tone decay.
we have, yes. Yeah, I think the younger graduate students may have read about it, but I don't think they do it on a regular basis.
And Bekesy audiometry was so effective
Yeah, it
because
was.
we could monitor how things were going over time,
Right.
which is just beautiful. So we did studies like that.
Yeah, and we had at University of Buffalo, we had a von Bekesy audiometer. It was the size of a car, and but it was very accurate. You would see these patterns over time, which gave you a lot of information all the way from the
Yes.
lowest lows to the highest highs, and it was brilliant.
You are exactly right.
And I think we've lost a lot. You know, we've gained a lot. We have things now like otoacoustic emissions, which are brilliant, and they tell you the
Yes,
of the outer hair cells up into the very high frequency.
absolutely.
As time goes on, we tend to lose many of the older tests that had diagnostic meaning. When you think about tone decay, for those who don't know, we would typically do that with perhaps 1,000 hertz tone in one ear, and we could measure it ipsilateral or contralateral, and we would be a supra threshold, above the threshold, and we'd see the middle ear muscles contract. And normally, I don't remember the scale. I haven't done this in decades, but it might take 10, 12, 15 seconds for that reflex to let go. And what happens with otitis media children, oftentimes the reflex doesn't go anywhere near as long as it should. So let me ask you a question. This is the one that I think everybody's kind of interested in. How did you come up with the SSW? Where did that come from?
I was doing my doctoral dissertation, gathering data at a hospital in Pittsburgh, and the audiologist was going on vacation, and she asked me if I would like to take her place during the summer, to take this month and be the audiologist there. And I said, oh, great, because I was a new father, and we could use a few more bucks. And so I jumped at that. One afternoon during lunchtime, an ENT came in, and he said, have you heard about the work that they're doing in Europe identifying temporal lobe tumors in patients using hearing tests? I said, what? Yeah, in school, we were taught that you can't test the auditory system beyond the eighth nerve because of all the decussation.
Right.
So couldn't imagine that. So then he started to read what they did. And this particular study, they took a word and they took a band of high frequency, sent it to one ear. They took a band of the low frequency, sent it to the other ear, and the person had to come up with the word. And that's how they identified, they didn't say exactly how. That's what they found, that they could identify temporal lobe tumors, see on which side it was. And then the very last sentence in the article was, unfortunately, it didn't work if the person had a hearing loss.
Right.
Out of my mouth came, why don't they use spondees? And then I thought again, oh, I said, hey, that's a good idea. Why don't they use spondees? Do you want to do this project with me?
That's brilliant.
He said, oh no, you go ahead.
Yeah.
And so, but with my poor memory, I don't know how much longer I remember that, but at night, I was feeding my son. I had the 12 o'clock and 2 o'clock feedings.
Right.
Had to be fed every 2 hours, day and night, because he had had surgery and he had just come home from the hospital. And in order to give Irma some time to sleep, I took those 2 hours. So she got about 6 hours of sleep in there.
Right.
So at midnight, as I was feeding him, everything was so quiet and so restful. And I start to remember what happened at lunchtime. And I thought, how could you use spondees? Now, these people were taking part of the word here, part of the word there.
Yes.
There's no way in the world. I didn't have any equipment. So I said, well, maybe we could just put 2 spondees, one in each ear, and maybe that would work. And see,
So what year was this when you were thinking this through?
Late July in 1960. The reason why I know is because Mark was born in June.
Oh, of course.
At 3 weeks, he went to the hospital for surgery.
Yeah.
Then when he came back is when this happened.
So for those who are not necessarily up to speed on the Staggered Spondaic Word test, a spondee is a 2-syllable word, equal emphasis on both syllables. So you have hundreds of them, words like upstairs, downtown, baseball, hot dog. So what you did is you started to put a 2-syllable word upstairs here and a word like downtown on the other side, and upstairs, downtown could be converted by the person. They could repeat it exactly as it was, or they might take a little bit of each. They might say uptown, downstairs, right? So there are lots of ways that you could say those back, and the pattern of that the patient would repeat it, that was where the information was revealed.
So, yes. And so I was thinking about that when I was feeding him, start to think of what kinds of spondees. And as soon as I put him down to sleep, I start to write down all these different spondees, and that one would go on one ear, one would go to the other ear. And then I thought, wouldn't it be interesting if we pushed one up a little bit? And so it was one word to, let's say, the right ear.
Yes.
Then the second word to the right ear, as well as the first to the left, and then the left.
So they would overlap a little bit.
Yes. I said, wouldn't that be interesting? Because then you could compare competing and non-competing and see what the influence is of the competition or no competition. And so then the first word had one task. The second word had a different task. We couldn't always have right ear and left ear. I said, we have to go back and forth between right and left. So alternate them. So once we start to alternate, and I said, well, the person won't know sometimes which ear to listen to. We better have an introductory phrase.
So, say the word.
Yeah. So I thought, say the word. So they would know, and then they heard the first word there.
Right.
And then, so this way they would know what to listen for. Interestingly, eventually, all of those little things that we did turned out to have significance. People who repeat, they say yes after each one, for example. So that's a TFM sign, tolerance fading memory sign.
Right.
And so anyway.
And what year was the first formal recording? I was thinking it was about 62 or 63.
It was, if that was 60, then I finished my degree in 61, and then it was 62. 62, it was, yes.
And how many versions of the SSW are there now in 2024?
There have been, so that one of the students was the speaker, and I was the person telling him when.
Right, you were the director producer. Yeah.
Yes.
It makes it so simple and so easy. And it's still something we have to talk to patients about, because so many of them confuse hearing with listening. And they're not synonyms. They're very, very different. And what you do with what you hear, that kind of nails it, I think, for so many people. Tell me about, Jack, I know you did a lot of work also on phonemic synthesis. And I'll give an intro. Phonemic synthesis was, if we take the word cat, so it actually has three phonemes, ka, a, t, and dog would have three phonemes, da, aw, g. And what we used to do 40 years ago, 45 years ago in class, that was a standard therapy for children who had difficulty understanding words in general, but speech and noise in particular. Are you still doing phonemic synthesis, and do you still think it has a place?
Oh, absolutely. Absolutely. When people have otitis media, it screws up our understanding of the speech sounds. For example, you talked about you got a job because of your experience with
Right.
spectrogram. Yeah.
Yeah. So you had tasked me in college with looking at spectrograms to help you determine which were the best representations of speech sounds.
So there was a student who worked in the lab, and he told me that if I wanted, we could, and he knew I was interested in otitis media, that we could take an animal and actually put fluid in the ear and see what electrophysiologically was going on.
Right.
So that's what we did. We took W22s, put a loudspeaker a foot from the chinchilla's ear, and played, I don't remember how many. I do know that I had 10 words, 7 or 10 words. So there was a electrode right next to the oval window.
Sure.
Is where he had it. And so then he filled the bulla, the middle ear, with fluid similar to otitis media, similar thickness. It can't be meaty, but and then we played it again. Now, the first thing I wanted to know is if there was evidence of a hearing loss. There had to be a hearing loss.
Sure.
He indicated it was. I was recording in my office what was happening there. And so I had the first recording with no fluid. And then he did it again. And I wanted to see what the relationship was between the intensity of the two. So I increased the intensity. It was probably about 20 decibels. I increased the intensity. I didn't want to see how much hearing loss there was. I wanted to see what was happening, what the relationship was. So I kept them at the same level. And so that's when we got to see the crazy things that were going on.
Well, I think it makes good sense. And I think that that's turned out to be the issue, is that when you have otitis, of course, you have the attenuation of all sounds, but then you have distortion of most sounds. And then you also have the sound of the fluid, which we don't really think about, but it's there, and it has to be dealt with. And unfortunately, the brain is getting a signal that varies so much. It's quite a challenge to make any sense of it at all. Tell me about, what are your thoughts on OTC, over-the-counter hearing aids? Because this has just come about almost 2 years ago. The FDA approved them, and I'd like to get your perspective.
Yeah, I have very little perspective. I don't know people who have gotten them, and I don't know what they went through to get them. I don't know what the evaluation was. I don't know who tested them. And what I would say is that if they just got them over the counter, that would be atrocious. If they had somebody who was well-trained with the equipment and hearing loss and the benefits of amplification, who not only could help them, because for me, when I get my hearing aids, new hearing aids, let's say, I'm always going back a second or a third time.
Sure.
I said, I need more high frequency. I'm having trouble with such and such. And if the person is not sophisticated and not interested, if it's not part of their work, they're just there to sell a hearing aid. So that's going to be awful for the person.
Okay. Okay. And I can't disagree. I think one of the things that I was urging the FDA to do 6 or 7 years ago when all this started, 2016, 2017, not just me, but many of us, we were saying, the thing is, if you're going to have OTC, that's a matter of what product to wear. But what we had said is, wouldn't it make more sense for the FDA to either strongly advise or to mandate that they get a test and, the test interpretation, counseling, recommendations from a licensed healthcare professional, and then buy whatever you want to buy, but at least now you have the knowledge to know what you're looking for. As you know, that didn't sell. They didn't do that. Anyway, let me close on this question, Jack. You've been very generous with your time, and I totally appreciate that. For the hundreds or thousands of people, professionals that you have personally motivated and inspired, I think each of us knows that Irma has been a rock and supportive and integral to all of these products and processes. And I could tell you stories. When we were graduate students, we would have parties, and that's how I met Irma. She would come to the parties. She would come to the after hour. We would go after clinic, sometimes to a local restaurant called Chi-Chi's in Buffalo, and Irma would meet us there. And she was always a big part of our education back in those days, and of course, your life. So can you share for us your thoughts about marriage, children, and the keys to a happy, joyful, and productive life? Because it seems to me you are an exemplar of all of that.
Well, thank you so very much. And when I got engaged to Irma, I was in college, and in my last year, suddenly my grades went up, and they've gone up since then, since we've been married. And I think her family was so education oriented. Her parents, father had a PhD, mother had, I don't know what training, but they were very, very smart. And so they were very school oriented.
Yes.
And I think that had an effect on me. But Irma has all the skills. I didn't get to tell you about all of my difficulties, but I have memory difficulties, and I have speech and language and reading and other difficulties. And all the things I'm weak in, she is strong in. So to this day, I have to say, who is such and such? And do you remember this and this? And when I wrote the first handbook, in those days, there was no fancy equipment, and it was my responsibility to do the index. How could I possibly do the index? And so she has a degree in library science, and she went back for a special course in indexing. And so she indexed the first 3 issues of the handbook. And after that, they had them all, they did it by...
All computerized now.
Yes. So, and for spelling, to this day, my spelling is so poor. So I'm constantly asking her, and what is the word that... And so she has helped me immeasurably. And now that my kids are grown up, they are just terrific, helping me in so many ways. We're such a close family and take really good care of each other.
That's fantastic.
Yeah. So I'm so grateful. And so here, Irma and I are married 68 years, and this month will be 69.
Fantastic. Incredible. Well, listen, Jack, I think I speak for the entire profession, which I rarely, if ever, have done. But if I were to speak for the entire profession, I would have to say that your contributions have inspired and motivated all of us. And it's just astounding between the the SSW, the competing environmental sounds, the phonemic synthesis, the many, many editions of the Handbook of Clinical Audiology. We didn't get to the Handbook of Clinical Audiology today because we don't have time for that. That's tens of thousands of pages. I think we put them all together. But it is the backbone of so many audiology programs. And you used to refer to it as HOCA, HOCA, Handbook of Clinical Audiology. I think now it's in its 7th or 8th revision, right?
Yes, it's the 7th, and I am hopeful that somebody else is going to do the 8th.
That's fantastic.
Yeah.
All right, Jack. Well, listen, I'm going to let you go, but love to you, and thank you so much for being the person you are. I've often said you're one of the kindest, gentlest, most loving people I've ever known in my life, and I so appreciate you.
Thank you so much, dear friend. It's so wonderful to hear that. Thank you very much. Best of luck.
Take good care. Yeah, I'll talk to you soon.
Bye-bye.